Hello, I'm Paula Luna from Buenos Aires, Argentina. I'm a dermatologist and pediatric dermatologist. And as a member of the International Eczema Council, I am really thrilled we have this appearance in RADLA this year. So I want to welcome you all on my behalf. I'm going to share my presentation on what's new in atopic dermatitis prevention. We all know that that prevention is better than cure. We've always heard that. That's what we all say. But is prevention feasible? Is prevention something we can really do? Prevention is a true challenge, and investigations regarding prevention are really hard because it acts as a population level, so it's very difficult to gather this information. Of course, we all know that there are 3 different types of prevention: primary prevention, secondary prevention, and tertiary prevention. And we're going to focus today on primary prevention because we just have 10 minutes. And I really like this meme from the National Eczema Association, where in this really graphical picture, they say the actual footage of me, of a patient with atopic dermatitis, figuring out what caused my eczema to flare up. This would regard more to secondary prevention or to tertiary prevention, not that much to primary prevention, but it might also have something to do. The evidence on prevention is very difficult to gather, as correlation does not imply causation. So this image tells that all. This fallacy of a cum hoc ergo propter hoc, which means that if this happens for this reason, and not necessarily that is that way in eczema. So the roles of emollients, that's what I'm going to focus on this talk. The role of emollients in the primary prevention of AD, it definitely has a role. Skin barrier might play a key role in the development of atopic dermatitis. Skin barrier dysfunction can be apparent in the first weeks of life, even before developing atopic dermatitis, which suggests that interventions to improve the skin barrier function from the early infancy, before atopic dermatitis appear, may have a potential role to prevent atopic dermatitis. And this has been widely studied mainly in the last few years. With this 2 first studies of 2014, I'm sorry, this first study of Eric Simpson with 124 neonates. This is not so new because it's nearly 10 years already. With this 124 neonates with high risk atopic dermatitis, where the lotion or the emollient was applied to the whole body, with this high-risk kids who had family members that had atopic dermatitis or other types of allergies. It was against controls who were asked not to apply emollients. And what they found was a statistically significant protective effect with an around 50% reduction of atopic dermatitis in those kids who had applied the emollient. So this was quite promising. And then another article appeared around the same time of this Japanese group with 128 neonates, also with high-risk AD, who applied the emollient for 32 weeks. The control group had to apply petroleum jelly, and what they found was approximately 32 fewer atopic dermatitis cases in the intervention group compared to the control group. So this was quite promising. This was quite some time ago, as I've said. But then 2 other articles appeared in the 2020 Lancet publication. These were 2 quite similar studies. One was called Prevent ADAL, or of the study of the prevention of atopic dermatitis through the use of skin emollients. They also used another intervention that was the early complementary feeding also to prevent atopic dermatitis and maybe to prevent food allergies. This was a population-based 2x2 functional randomized clinical trial in Norway and Sweden. They divided the patients, they randomly assigned them to no skin recommendations plus standard feeding, skin bath oil and facial emollient just in the face, and standard feeding, and then no skin recommendation plus early complementary feeding, and then the one that had the double intervention that was skin bath oil plus facial emollient plus the early complementary feeding. The primary endpoints were regarding atopic dermatitis at 12 months, and there were other exploratory outcomes too. The patients were evaluated at random at 0, at 3 months, 6 months, and 12 months, and they were given electronic devices to complete weekly their evaluations. And this study, unfortunately, did not find any benefit of applying the emollient or the early complementary feeding in preventing the development of atopic dermatitis at age 1. But what is interesting is that this was in the general population. They did not stratify by history of atopy. This second study that also appeared in the Lancet was a multi-center pragmatic parallel group randomized controlled trial in the UK with term infants that were all high risk of developing eczema. They were randomized into two groups: best practice skincare advice plus moisturizers, and then another one also with best practice skincare advice but with no moisturizers. And they were evaluated by a blinded assessor. They were followed at week 2, 3 months, 6 months, and 12 months, 18 months, and they were finally evaluated at 2 years. The daily emollient was applied just for the first year. So what they did was that the evaluation at 24 months, you did not have the immediate effect of the emollient. You had to see if they really prevent it in a more long term. And the primary endpoint was the diagnosis of atopic dermatitis over the past year. And the secondary endpoint was eczema and 2 different evaluations and other allergies. And they evaluated the infections and the emollient related slippages. 1,394 patients were evaluated, and there was no evidence that regular emollient used for the first year of life could delay, suppress, or prevent eczema at 2 years. And there was no evidence that emollients reduced the risk of food allergy, but they did find a small increase in skin infections. So they concluded something very interesting, and that said that the lack of benefit of emollients for prevention of eczema seen in this study was unexpected. All the other previous studies that I've shown and several others that I didn't show seem to give this emollient a really big amount of benefit, but these 2 studies did not. And so it's important to continue studying. This systematic meta-analysis of Cochrane database analyzed all these studies and many more, and they concluded that emollients during infancy probably do not prevent eczema from developing, and they probably increase the risk of local infections. I am again talking just about primary prevention. Of course, we do know that emollients do have a very important role in secondary prevention and prevention of flares and as steroid-sparing agents, but they seem not to work as a primary prevention intervention. Studies aiming to evaluate primary prevention of atopic dermatitis via the application of emollients to unaffected infants has shown conflicting results. Earlier studies suggested this practice were effective. More recent studies suggest they are not. Difference in designs, population, outcome measures, and interventions. And we need more studies focusing on primary prevention because, as I've said earlier, prevention is better than cure. Thank you very much. And I'll be here for questions.